Studies are being conducted to gauge COVID-19 infection levels among Singapore's population. Initial findings have shown up some areas of underestimation, although there were no widespread community transmissions in the last 2 weeks of March. Isabel Lim looks at what the results mean for how the authorities are tackling the pandemic.
More than 2,000 individuals have been tested for the 3 different studies so far, with each focusing on a different target group: frontline healthcare workers, close contacts of confirmed COVID-19 cases, and the general community. Researchers say the findings are important to confirm how accurate current methods of diagnosing cases have been, but the results also reveal how susceptible the population still is to the virus.
It tells us that, by and large, as of the middle of March, the epidemic in Singapore was largely under control. It also tells us that going forward, the vast majority, 99.99% of our population remains susceptible to this virus, and we need to then have that vigilance going forwards.
The test checks for the presence of antibodies, which means it can detect if someone has had the disease even after recovery. While there was no widespread community transmissions as of the last 2 weeks of March, there have been some areas of underestimation. Previous tests only picked up half of the people infected among close contacts of confirmed cases in a household setting.
About 2.5% of individuals that were placed under quarantine order among household contacts were initially detected via swab test and PCR to have COVID-19 disease. As you know, some of these household contacts under quarantine would not have undergone PCR testing, mainly because they did not report symptoms and hence were not tested. So of those individuals that either were not tested or did not have a PCR positive, we detected a further 2.5%.
The results, researchers say, bolsters the logic of keeping close contacts under quarantine despite individuals reporting no symptoms. Another high-risk group that these studies have focused on are healthcare workers. Nearly 1,100 of them from NCID, Tan Tock Seng Hospital and NUH are taking part in the study. No one has tested positive, but they'll be retested in 2 months' time.
The idea of retesting these individuals is really to diagnose new cases of infection. A lot of things have changed from the time when we first recruited our first batch of healthcare workers in early March. During this period, the number of cases in Singapore was in the early triple digits. Things have changed drastically. We now have about 14 to 15,000 patients diagnosed with COVID.
The studies will be expanded to include more healthcare sectors, such as polyclinics, and larger samples from the general community to more accurately reflect the state of infection among the population. The studies are ongoing, with the study follow-up for healthcare workers expected to be until the 3rd quarter of 2021.